for feeding. The second drug that is approved in few countries around the world is Edaravone. It has an antioxidant agent action and was first used to treat stroke patients. It's not registered by European Medicines Agency, but it just slows the rate of functional loss by over 33%. There is no data on the survival. There was a very recent German study completed, which didn't find any difference between Edaravone and riluzole against riluzole only. It was available for venous treatment, but since this year there is also oral pills available, which is by far most convenient for patients. These are the only drugs that are registered. There's also two other drugs, Tutka, which is Tauro-Urso ursodiol, and phenylbutyrate. This is two substances, two molecules that together prolonged survival and reduces the number of hospitalizations. It is only second stage of the drug trial that was finished, and sodium phenylbutyrate and Tauro-Ursodiol, they are kind of affect cell function. There is very little of potential side effects. These two drugs are since September this year registered in USA as Librio and in Canada as Albrioza. We are happy here in Slovenia that are using these two drugs since June last year already. There is many ongoing clinical trials that are listed here that are still not finished yet. And this is mainly, I'll switch now to the gene and stem cells therapy. There is several possibilities to use gene therapy. One is use of antisense oligonucleotides, and the other is therapy based on viral vectors. The trial has been finished. It is on tofersen that is used to treat patients with SOD1 mutations, while stem cells, they are actually targeted to normalize cellular microenvironment and not to replace motor neurons. There is no definite evidence yet as to their safety and efficacy. They might cause tumors, for example. As to the conclusions, the last 3 decades have been have seen much hope and as well much disappointment for promising pharmacological therapies. Only 2 drugs, riluzole and Edaravone, have shown slightly positively effects on the course of the disease. This is very likely the result that the disease is very heterogeneous with regard to the clinical presentation and pathogenesis, and it is very likely also that a single therapeutic approach is likely to be ineffective for all patients. And there is much hope because of the deciphering of many pathogenic mechanisms, especially in these genetically determined disease patients. Thank you very much.